Christina here, speech therapist with Adaptive Equipment and Caregiving Corner. Today we're highlighting a caregiver resource called Accredited Home Healthcare Directory. This resource was developed and is maintained by caregiver Cindy Rogers. If you find this video helpful, be sure to like and share on Facebook and Instagram, subscribe to our YouTube channel, and check us out at aecorner.com. So let's get started.
I have Kathy Garland with me today. Hi, Kathy. Kathy has partnered with Cindy Rogers, and Cindy is the founder of Accredited Home Healthcare Directory. And Kathy is going to be sharing some information with us about Accredited Home Healthcare Directory. Hi, Kathy. How are you?
I'm good. Thanks for having me.
I'm very good. Thanks for being here. We appreciate it. What's the purpose of Accredited Home Healthcare Directory?
You know, we connect, it's a directory, so we connect quality accredited caregivers with those who need care. But we also educate caregivers, those needing care, their families, and really anyone who has the burden of providing care on things like how to get started in home health care, what Medicare or Medicaid might provide or cover, what other groups might cover, what other groups exist, quality of life products, and support resources.
Okay, great. So anybody can just go out to your directory and find information or more information about what you just listed off.
That's right.
What does accreditation mean, and why should the viewers care?
You know, accreditation is not a word that we usually think of, especially when a family is in need of care. But accreditation is an intense process during which a national accrediting body reviews a home healthcare agency for quality, their staff, their facilities, their processes, their hiring processes. Everything is very much excruciatingly looked at. Okay, yeah. It's a very intense process, and there are 3 national groups that do this, but it's really, the bottom line is it's the best possible way to ensure quality. Accreditation affects the care that your loved one is going to receive, what the family support is going to be, and at times even the reimbursement, because payers like Medicare pay more sometimes for higher rated agencies. So that's very, very important. So when a loved one is released to home health care, you know, they've fallen, or there's some kind of a situation, which it's not all elderly. Sometimes it's sports injuries. You know, there's children who need home health care as well. But usually it's the elderly, and families are completely unprepared and they're not sure where to begin. And, you know, as they're driving home from the hospital, they might see a billboard or some advertisement that says, you know, we provide care, or maybe they saw a jingle on TV or something like that. So rather than relying on some advertising to find the right place for your loved one to come into the home, a trustworthy person, we've compiled a state-based, so it makes it easy, right? A state-based directory of accredited caregivers to make it easy for a family to find someone near them or near the loved one. Because in many cases, the family lives farther away and they need to find somebody who's where the loved one actually lives. So it could be totally different states in many cases. Sure. So it's connecting the two together.
Okay. So kind of walk me through that then, Kathy. So let's say, and let's use 2 different states. So let's say I'm in Illinois, and let's say my mom lives in, let's say she lives in Virginia, and I need to find some home health care for her because I can't be there for her. What would I do as her daughter? What would I do? What would be my first steps? And then what would I need to do to get onto your resource and then to use your resource the way it needs to be used?
Right. Perfect scenario. And that's exactly how it happens. The doctor has released them. And usually you would be there for like a week or 2. Maybe you've taken off of work. This is a struggle. You've got to get back to work. You know, so there's a lot of stressors involved. Sure. And speed is of the essence because you've never taken care of your mama this way. And you don't know exactly what's involved. You haven't been trained to give medicines, to help them with their daily needs. And you're already maxed out and stressed out. So the doctor gives you the paper and says, take her home. She can stay at home, get some home health care. And sometimes a nurse will kind of work with you to kind of help you a little bit there and do use those resources, that they give you. But first thing I would do is I would pull up Accredited Home Healthcare .directory. So it's not .com, so it's a directory. So .directory. And I would look in Virginia, and I would see that there's, anywhere from a dozen to 24 locations, and probably isolated based on the city. There's probably going to be 1 to 2 in that area. Then I would look in our archives for the articles to see what should I be asking these people when I call them up. Then I would call Medicare and Medicaid to find out what the benefits are that are included, because some Medicare doesn't even cover anything. Then I would find the article on Accredited Home Healthcare Directory that lists all the ones that do. So there's a number of benefits that, depending on the state, and then research whether or not my mother or your mother was actually eligible for something from those as well. Then I would schedule for those agencies to come out to meet your mother and or my mother, and to go through the home to help me. I know you guys provide some great resources. Before I even took my mom home, I would watch your video on all the corners and all the slippy things that are going to cause her to go back to the hospital. So there's those kinds of preparatory things. But in order to have care as quickly as possible, I would start the ball rolling by seeing who's going to give benefits. And if it's Medicaid, which in many cases it is, Medicaid won't kick in until a certain amount of money has already been spent down, is the term that's used, which affects an inheritance. And, for a lot of people who have a home and savings and what they plan to pass down to their kid, they didn't plan to spend it on home health care. They planned on passing it to their children. I would also look on the Accredited Home Healthcare Directory. There's financial gurus on there whose sole job is to help you understand what Medicaid will allow you to set aside for the husband, or for maintenance and just different things legally, because everybody starts to panic because it's not a cheap thing. It's very expensive.
Everything's expensive. That's right. Yeah,
it is.
So your directory is so much more than just a directory. I mean, that's awesome that you put together these accredited home healthcare agencies, but it's more than just a directory. It's even more than just a resource, it sounds like. So if I need to talk to somebody that's maybe an estate planner or something along those lines, you have that resource there for me as well. But you also, it sounds like what you're saying is you also are like an educational resource for me as well. So so you guys have articles on there that talk about Medicare, Medicaid. So that's a blog then, is that right then, Kathy?
Yeah, it's articles, but I would think of it like a blog. Those who are providing care suddenly, particularly, and those who need care need a lot of support.
Yeah.
And they need people to rally around them and answer their questions as quickly as possible. This is not something where you can wait for results. And when you deal with Medicare and Medicaid, you're going to wait. So better to know what you're up against and start the balls rolling. There's just way too much to do on their own. So yes, we've curated topics that you will encounter in the process.
Excellent.
And even tough conversations that need to be gotten through, because there's a number of really tough conversations that have to start being had, and they've probably been avoided up until this point. And then, like you mentioned, the financial guru who helps these people qualify for Medicaid while preserving their assets. And then we have some of you guys' videos on there because they're so useful. Even after they've come home, you kind of review those things and tell them what they really need. And I think that trustworthy people coming alongside these families to say, we're going to support you. We may not actually be there in person, but we're going to support you as much as possible. That's what we put on there.
I love that it's all in one area, and that you have, so I can read and research as much as I need. You've got the contact information for anybody that I would need to reach out to kind of drill down or give me more specific information regarding my specific situation. I love that. so convenient, kind of a one-stop shop kind of thing. And I think that's fantastic. I think sometimes, especially in situations when it's kind of a hair on fire situation, right? When it comes up, because we don't plan for it. We were talking earlier about it's just human nature to kind of be more reactive instead of proactive. But, when something comes up like that, you just kind of have to take people's words for it. And so you guys have kind of taken that aspect out of the whole thing, and added a certain level of trust, I would say, so that we can trust you that all of these facilities and all these places are accredited, and that you guys have done the legwork essentially to vet these resources for us, and that's fantastic.
Yeah, and the national accreditation bodies, they do the really intense scrutiny. All we're doing is, because there's 3 different websites and you probably don't think about them. I mean, when my mother, just recently I lost both my grandmothers. And when she went through this process, she knew nothing about accreditation either. And I was able to educate her just because of the situation. Yeah. And I said, when you go to a hospital and you deal with nurses and doctors, they've been to an accredited school. Yeah. That's how you know that they have been through a certain level of training and a certain level of process, and that hospital itself is accredited. Right. And all those facilities are accredited. This is how we make sure things are quality and stay quality, because accreditation isn't once, it's getting your
one and done.
Right. Yeah. When you get your business license, it's a one and done. Yeah. But when you get accredited, it's every couple of years. Yeah. So they're double checking the hiring practices and the constant continuing ed that they're required to have in order to stay up to date. All that is involved in it. We're just bringing it together in one place because nobody thinks about accreditation when they're going home. They're like, oh, I've seen, that one on the billboard. Yeah, that's exactly. Well, that's fantastic. We really appreciate all that you guys do for the people in our community, as well as throughout the country. It's an online service, so we can go out. Will you give us your how we can get a hold of you? What's your web address? Sure. It's Accredited Home Healthcare .directory, and we like to say not .com but .directory.
Yeah, it makes a difference, doesn't it?
It does.
Yeah. Okay. Well, Kathy, I really appreciate you coming here and talking to us about this. You guys provide such a wonderful service, and we are so excited to have you here and get to talk to you. Thank you so much.
Thank you.
And that's the Caregiver Resource Accredited Home Healthcare Directory. Be sure to check out the links below for further details. That's it for today from Adaptive Equipment and Caregiving Corner. Have a great day, and don't forget, if you can't do it, adapt it.